In this podcast episode, Dr. Rachel Rubin, a renowned urologist and sex expert, delves into the complexities of women's sexual health, hormones, intimacy, and relationships. The conversation covers a broad range of subjects from hormone therapy and genital health to the biology of orgasm, communication in relationships, and overcoming the misinformation that keeps many women from enjoying fulfilling sexual lives. A key theme throughout is the pervasive lack of education and awareness around female sexuality and health, both among patients and medical professionals alike. Dr. Rubin emphasizes how little is known and taught about women's hormones in medical training. Testosterone, often mistakenly labeled a male hormone, plays a crucial role in female libido, arousal, and orgasm. Unlike the sharp estrogen drop during menopause, women's testosterone levels begin declining in their 30s, which can affect sexual desire and response years earlier than many expect. Hormonal fluctuations occur across 5 life stages: puberty, fertile years, perimenopause, menopause, and postmenopause, each demanding different hormonal considerations. Medications like birth control pills alter hormone levels by stopping ovulation and reducing natural testosterone production, which can contribute to decreased libido for some women. Side effects of drugs, including antidepressants and newer weight loss medications like GLP-1 receptor agonists, are often overlooked when it comes to their impact on sexual health. Hormone replacement therapy, HRT, is explored in depth, with Dr. Rubin outlining its various components: estrogen, progesterone, testosterone, and vaginal microdose hormones. Misinterpretations of the Women's Health Initiative study from the early 2000s led to widespread fear of HRT, but recent evidence clarifies its safety and effectiveness when properly prescribed. Despite this, only a small fraction of eligible women receive hormone therapy, highlighting gaps in medical education and clinical practice. Starting HRT is not confined to postmenopause. Perimenopausal symptoms and individual needs should guide timing and treatment. The discussion draws attention to the genital and urinary issues many women face, often under-recognized or inadequately treated. Genitourinary syndrome of menopause, GSM, involves vaginal dryness, pain with sex, urinary urgency, leakage, and recurring urinary tract infections, UTIs, all linked to hormonal changes that disrupt the vaginal microbiome. Estrogen and testosterone maintain vaginal acidity and healthy bacteria, creating a natural defense against infections. Dr. Rubin highlights the underrated life-saving potential of vaginal estrogen, or DHEA, creams, tablets, and rings applied locally to restore tissue health. These treatments can safely improve sexual function, prevent UTIs, and are suitable at any age, including breastfeeding or elderly women. The irony concerns a prevalent reliance on folklore advice, such as pee after sex or cranberry pills, instead of evidence-based hormonal solutions. The pelvic floor is explained as a complex group of muscles supporting the pelvic organs, also critical to sexual function. Tight or dysfunctional pelvic floor muscles can cause pain during intercourse, reduce sensation, or impede sexual pleasure. Proper coordination and flexibility of these muscles facilitate blood flow, sexual arousal, and orgasmic muscle contractions. Pelvic floor issues can result from childbirth, surgery, or other physical stressors. Treatment usually involves specialized physical therapists rather than conventional gym exercises. Diagnostics and therapy targeting pelvic floor health are essential for women experiencing pain, lack of orgasm, or arousal difficulties. A major myth addressed is the assumption that penetration alone should trigger orgasm in women. Dr. Rubin stresses that the clitoris is the primary source of female orgasm, structurally and functionally homologous to the male penis, but largely internal and frequently misunderstood or ignored in medical training. Many women do not orgasm from penetration and require clitoral stimulation, often by direct or indirect means. The podcast reveals that about 20% of women report difficulty reaching orgasm, a contrast to men whose orgasm rates are significantly higher. An often overlooked condition called clitoral adhesion, where the clitoral hood sticks to the glands and obscures stimulation, affects roughly 1 in 5 women and can be treated simply with dramatic improvements in arousal and satisfaction. Vibrators and similar devices can assist by providing targeted clitoral stimulation, enhancing blood flow and muscle relaxation. The concept of multiple orgasms is also explored, with women physiologically capable of quicker recovery and repeated orgasms compared to men. Dr. Rubin critiques common male anxieties focused on size, stamina, and performance, highlighting how these have little correlation with female sexual pleasure. Instead, male partners benefit from increased curiosity about female anatomy, preferences, and response patterns. Effective communication and willingness to learn about clitoral stimulation, arousal styles, and individual needs are far more valuable than stereotypical concerns. The episode encourages couples to explore sexual education together, openly discuss likes and dislikes, and dismantle common myths perpetuated by pornography and cultural narratives that skew expectations and reinforce misunderstandings between partners. The impact of pornography on people's sexual perceptions is closely analyzed. Data suggest a large majority of porn consumers are men, skewing the industry toward male desires and not reflecting female experiences or preferences. This disparity contributes to unrealistic expectations and misinformation about sex and orgasms in heterosexual relationships. Pornography can serve as a healthy sexual outlet or educational tool, depending on usage, but over-reliance or secrecy about consumption risks relationship dissatisfaction, intimacy issues, and performance anxiety. Transparency and mutual understanding within relationships are key to mitigating negative effects. Central to improving intimacy and sexual satisfaction is cultivating open, empathetic communication. Difficult conversations around sexual needs, frustrations, fantasies, and boundaries should be normalized in a caring environment. Many couples suffer from a lack of dialogue, leading to assumptions, confusion, or feelings of rejection that erode connection. Dr. Rubin highlights the importance of recognizing that mismatched libidos or challenges are not the fault of any partner. Reframing issues as joint challenges rather than blame games fosters collaboration. Couples might benefit from professional counseling, sex therapy, or structured communication exercises to build trust and ease vulnerability. Scheduled intimacy, such as quarterly date days, is recommended to prioritize connection amidst busy, stressful lives. This intentional approach combats the myth that all sex should be spontaneous, which rarely aligns with real-life constraints. The episode acknowledges how modern stresses, burnout, and mental health conditions profoundly affect sexual desire and function for both men and women. Dopamine depletion from chronic stress reduces libido, and lifestyle factors like poor sleep and overwork diminish the energy and interest needed for intimacy. Understanding these biological effects helps reduce shame and frustration. Solutions include stress management, setting boundaries, and recognizing that libido fluctuates with mental state. Addressing these underlying contributors is as important as physical or hormonal treatments. Negative body image issues frequently inhibit sexual confidence and enjoyment. Dr. Rubin notes the paradox wherein women often pour significant energy into weight loss rather than strength building. But regardless of body size or shape, everyone deserves fulfilling intimacy. Changing self-perception through empowerment, education, and compassionate communication with partners improves sexual well-being. Normalizing diverse bodies and appearances challenges cultural and internalized stigmas that interfere with sexual pleasure. A recurring theme is the profound lack of appropriate education on female sexual anatomy, physiology, and health among both patients and clinicians. Many women feel dismissed or receive ineffective care because providers lack training or comfort discussing sexual issues. Dr. Rubin is passionate about advocating for better medical education, wider access to hormonal therapies, and empowerment of women to understand their bodies and advocate for their health needs. This includes demystifying language around genital anatomy, sexual function, and treatment options, enabling women to make informed choices about medications, devices, and therapies. Painful intercourse is prevalent, affecting up to 75% of women at some point, and up to half during menopause, yet it remains inadequately addressed. Causes include hormonal imbalances leading to tissue thinning and dryness, skin disorders, pelvic floor dysfunction, nerve issues, and scars from conditions like endometriosis. Women deserve thorough evaluation and individualized care plans that include vaginal hormones, physical therapy, medical interventions, and counseling to restore comfort and sexual satisfaction. Silence or normalization of pain perpetuates unnecessary suffering and relationship strain. The discussion also touches on the wide variety of sexual preferences, fantasies, kinks, and relationship styles. Acknowledging this diversity and encouraging curiosity and honesty allows partners to explore safely and respectfully. Seeking help from therapists or using communication tools can assist couples hesitant to broach vulnerable subjects. Fantasy may not always translate into desired behavior, but sharing these can deepen intimacy. The goal is mutual understanding and a relationship dynamic that honors both partners' needs and boundaries. Men are encouraged to approach their female partner's sexuality with openness, empathy, and curiosity, two qualities essential for deepening connection, but often underdeveloped due to social norms and lack of education. Willingness to listen and experiment can revolutionize sexual satisfaction for both parties. Dr. Rubin praises the podcast host's vulnerability in asking naive questions and admits that many men assume silence equals satisfaction, which can be a dangerous misinterpretation. Active engagement in dialogues about intimacy fosters healthier, more joyful relationships. Finally, Dr. Rubin stresses that understanding and addressing the biological aspects of women's sexual health is fundamental. While psychosocial factors matter, denying biology leads to neglect of treatable conditions that impact libido, arousal, pain, and overall pleasure. Women must be encouraged to advocate for themselves and seek care that acknowledges hormonal, neurological, muscular, and tissue-related components of sexual function. Greater physician training and patient awareness will help bridge this gap, ultimately improving quality of life and relationship satisfaction for millions.